Hello, everyone. We are here today to present our accreditation plan for Fulton County Board of Health in Fulton County, Georgia. Our team became interested in Fulton County for a number of reasons. One, given that it's the largest county in Georgia based on population with over 1 million residents, we found it interesting that it's not currently accredited. It's a diverse county and quite affluent, with higher than average income earnings and more educated residents. Yet there are groups that are disproportionately affected by adverse health outcomes, and this is especially the case with gun violence and opioid-related deaths. And some of these groups have been identified as Black and Latino residents, single parents, and new Americans without legal immigration status. We also found it interesting that the Georgia Department of Public Health resides within Fulton County, as it's located in Atlanta, and wondered if there were unique resources available to the local health department because of this proximity. The Fulton County Board of Health is not accredited by the Public Health Accreditation Board. The last community health assessment was completed in 2020, as was a strategic plan, although a community health improvement plan was not completed. All three of these things are required by the Public Health Accreditation Board and will be a significant focus of our proposal. No identified accreditation coordinator exists to this point, which will also be a significant focus of our plan, as well as the development of a clear mission and vision statement.
The areas of focus for our plan will include expanding behavioral health services. Since 2010, the number of opioid-related emergency visits and opioid-related deaths have increased. Target measures for expanding behavioral health services include number of persons who receive behavioral health services, percentage of residents engaged in substance abuse treatment for opioid drinking and vaping. Next area of focus would be HIV/AIDS prevention. Fulton County is ranked 6th highest among U.S. counties for the new HIV diagnosis. The target measures for HIV/AIDS prevention include tracking newly diagnosed with HIV, proportion of newly diagnosed HIV cases attending medical care appointments, knowledge of status, viral suppression, and PrEP coverage. The last area of focus would be firearm violence prevention. According to the 2022 County Health Rankings, the number of deaths due to firearms per 100,000 is 17, compared to the state value of 16. Target measures include rate of conflict-related deaths, rate of non-conflict violent-related deaths, and rate of non-fatal firearm-related deaths.
Upon researching the health needs of Fulton County residents, three main goals of interest were created along with the measures to track progress. The first goal was to expand behavioral health services for Fulton County residents. To measure this, we will surveil the residents through Fulton County Human and Health Services that sought behavior health care services and increase the number of unique patients by creating appointments with a licensed practitioner. The second goal was to improve access to HIV preventative care services. The way we're going to measure this is by utilizing Georgia's Department of Health Prevention and Care Council to track HIV cases, also to secure funding allowing for the increase of HIV care services. The last goal that we had was to decrease gun-related acts of violence and deaths. To measure this, we would surveil the deaths and crimes caused by gun violence by utilizing data from the Georgia Department of Public Health. For the balanced scorecard, it allows for the organization of goals and measures. To strategically plan for these goals and measures, we utilized four perspectives within the balanced scorecard. The first perspective is the program perspective, where we ask the question, how is Fulton County Department of Public Health providing quality services to improve the health of residents? Here is where we explain more thoroughly of our goals and our measures. For the second perspective of the balanced scorecard, we utilize the process excellence perspective, where the question, How effective are the processes required to satisfy the expectations to improve community health? In this portion of the balance scorecard, this is where an operational plan and strategic plan are created, along with the assembly of an accreditation team. Finally, the last two perspectives of the balance scorecard are the internal organizational perspective and then the financial perspective. For the internal organizational perspective, we ask the question, how can we use human resources and skills to efficiently offer programs in creative ways? For the financial perspective, we ask the question, how can we ensure we have proper funding for allocating resources? Essentially, we are looking to ensure that we have the money and the manpower to meet our goals and measures for achieving accreditation.
For this proposal, we recommend that Fulton County update their documentation. The COVID-19 lockdown negatively affected eating habits, physical activity, and mental health. Therefore, there should be an assessment to reevaluate the current health status of the county to ensure that the results that will be submitted for accreditation are reflective of the current health department, as the last CHA was in 2020. This process should take up to 6 months to complete with the aim of achieving accreditation within a 5-year time frame. We also recommend that they isolate priority issues using the data obtained from the CHA. In Fulton County's 2020 CHA, they were able to identify several prevalent health issues. However, they did not provide a concise priority list that would guide future plans. According to the National Association of County and City Health Officials, Phase 4 of the CHA and CHIP, the participants should develop an ordered list of the most important issues facing the community, consolidate overlapping or related issues, and the final list should include no more than 12 issues. Our next recommendation would be to create a collaborative network. In Fulton County's 2020 CHA, they collaborated with most of the NACCHO's recommended partners to produce the CHA. Therefore, they should utilize their previous CHA collaborators list or obtain participants from those same organizations for the CHA and CHIP and strategic plan. Lastly, we recommend initiating a steering committee that should be recruited and selected in Phase 1 of the CHA-CHIP process. The steering committee will contain high-level stakeholders to ultimately increase the chance for program success by closely aligning the program's goals to organizational goals, resolving conflicts between stakeholder groups, addressing external threats or issues emerging outside of the program that can impact it, and a review and approve changes made to the program's plan.
Some of our intervention strategies will include implementing performance management and quality improvement programs. And this is really to ensure efficient and effective collaboration, as research shows that that is really key for long-term sustainability. Also, we want to help with more effective prioritization and allotment of resources. We'll continue to implement ways and methods to ensure that the appropriate planning models are used. And in terms of thorough data collection, we will initiate a process to account for the completion of tasks throughout the development of the next community health assessment and community health improvement plan, with special focus on groups that are disproportionately affected by adverse health outcomes. Cultural competency training is a must, as not only is this a requirement from the Public Health Accreditation Board, but studies show when these trainings are done in conjunction with the development of CHAWS and CHIPS that there's an increased likelihood of performing activities to overcome health disparities. This is a visual representation of the intervention strategies our team are proposing, which include the Fulton County Board of Health utilizing existing relationships and collaborations, including the Community Advisory Board, to set up an accreditation team. This will include clear role delineation and implementation of an accreditation coordinator. who will then develop a clear mission statement and clear vision statement that will be incorporated into the next community health assessment, community health improvement plan, and strategic plan, with quality improvement and performance management systems along the way to ensure efficient and effective progress, all leading towards public health accreditation. Please take a moment to look at our references. Thank you so much for watching our presentation.